Hello and welcome to the Royal Orthopaedic Hospital NHS Foundation Trust. This video is all about helping to prepare you for your joint replacement surgery and for a speedy recovery afterwards. There are three aims: how to prepare for your surgery, what to expect when you're here, and planning for your return home. Being prepared by doing lots of small things will make you feel better. It'll also help you leave hospital sooner. Many of our patients leave hospital just 2 or 3 days after surgery. So first, what is joint replacement? The consultant orthopaedic surgeon will replace the parts of the joint affected by the arthritis with metal, plastic, or sometimes ceramic components. The first thing that'll happen in preparation for your operation is that you'll have to attend a pre-operative assessment clinic and have various routine investigations and tests. These include blood tests, a heart tracing, swabs from the nose and groin areas to exclude infection, and a urine test. The pre-operative assessment appointment usually takes about 90 minutes. It's vital you attend as we need to check your fitness for surgery. You can be accompanied by a friend or relative if you wish.
That's fine.
Thank you.
Okay.
A detailed assessment will be made of your general health and any medications you take. We'll also look at your social needs in preparation for your return home after surgery. Some of our patients may be eligible for our hospital at home service, and this will be discussed with you at this appointment.
Hi, my name's Sandra. I work for the therapy department here at the Royal Orthopaedic Hospital.
You may be asked to attend our joint workshop, which is led by the therapy team. It's designed to give you important information about your planned joint replacement. They'll tell you everything you need to know about your admission, hospital stay, return home and recovery. This is also an opportunity for you to ask any questions. Finally, you may be assessed for any relevant aids and equipment you may need to help you in your recovery at home, including any occupational therapy aids and walking aids. When you receive your admission letter, it may be many weeks until your operation. While waiting for surgery, it's very important and a fantastic opportunity to improve your health and general well-being. This is absolutely key in helping to improve your recovery, and we can't stress enough that you follow our advice. First, we recommend you eat a healthy, balanced diet and keep well hydrated. Avoid caffeinated and alcoholic fluids, especially during the week before your surgery. If possible, take regular exercise such as walking or swimming. You may have been advised to reduce your weight in preparation for your surgery. Exercise and a healthy eating plan will help with this. If you smoke, this is an ideal opportunity to give up, and your GP or practice nurse can help you with this. Stopping smoking will aid your recovery and help the healing process by reducing the risk of complications such as deep vein thrombosis. Stopping or reducing alcohol intake to within recommended guidelines is also advised prior to your admission to assist in a successful recovery. The message is quite simple. The fitter you can be, the better your recovery. If you're concerned about your health, or if there have been any changes to your health after your pre-operative assessment, please contact the assessment clinic to inform the nursing staff. Contact details can be found in your appointment letter. We need to know about any newly diagnosed conditions or episodes of infection, such as dental, chest or urine infections. We also need to know about any skin conditions, such as skin or nail infections, cuts and rashes. Now for some other tips to prepare you for your hospital stay and for your first few days at home. Stock up your freezer with easy-to-prepare meals. Organise cupboards to ensure regularly used items are within easy reach. Declutter and remove small mats and rugs to make sure your home is as safe as possible. Remember, you'll go home on 2 sticks or crutches, so ensure you'll be able to manoeuvre easily around the furniture with these. You should install a stair rail to help you climb the stairs more easily. Identify a friend or relative who can be available to help you on your return home. This could also be a good opportunity to make arrangements with your family or carer for transport home. It is safe to travel by car, and we can advise you on how to get in and out of the vehicle.
Hi Kate, it's only Dad, alright?
And finally, if you have pets, you may need to think about how they will be cared for during and after your hospital stay. The aim is to ensure your return home is as smooth as possible. Please let us know if you have any concerns about returning home, so these can be sorted out before you come into hospital. The first thing to think about is clothing. We encourage you to dress in your own clothes as soon as possible after surgery, as this will aid your recovery and help you regain your independence sooner. So, what clothes should you bring? Well, simple, lightweight clothing such as ladies' skirt and top or gents' shorts and top with supportive footwear. Bring your toiletries, glasses and dentures. You'll be given a green bag at your preoperative assessment for any medication. On admission, bring everything, including tablets, liquids, capsules, creams, eye drops, patches, inhalers, sprays, and anything you may have purchased from a chemist, supermarket or health store. It's important to bring medications in the original boxes with the labels attached. This will ensure the correct medication is prescribed for you during your hospital stay. Also, please ensure you have repeat prescriptions ready of your routine medications so you have adequate supplies on your return home. Mobile phones can be used in hospital as and when appropriate, but please do not use chargers and be considerate to other patients when making and receiving calls. Please leave cash and valuables at home and avoid wearing jewellery. Only have small change for a newspaper if required. The Trust will not accept responsibility for any loss of property unless it's been handed in to staff for safekeeping. Put everything for your hospital stay in one bag, as storage here is limited. It'll also make it easier for you to transfer between wards. Okay, it's almost admission day, and it's important that when you go into theatre, your stomach is empty of food.
What seems to work very well is if you have a good-sized glass of water before you come to hospital. So before you get into your car to be driven to the hospital, have a glass of water and then let the nursing staff know when you arrive that you have done this. If for any reason you are likely to be delayed before going to surgery, or it is anticipated that there's going to be more than a 2-hour wait from when you arrive to having your surgery, then the nursing staff will encourage you to continue to drink clear fluids up until 2 hours before your operation. Regarding solid food, it's safest if you actually have about 6 hours between your last meal and the beginning of your anaesthetic for your operation. Now, for most patients, that will mean that if your operation is going to be in the morning, that probably you're not going to have anything to eat after you go to bed the night beforehand. If, however, your operation is due to be in the late morning, it is possible that you could quite safely get up rather early in the morning and have a light breakfast. Again, your surgeon will discuss that with you prior to listing you for your operation.
Please have a bath, a shower or a full wash, including your hair, the night before surgery and, if possible, on the morning of the operation itself. Take your regular medication in the morning as prescribed with water. If we don't want you to take medication on the morning of surgery, we'll tell you at your pre-operative assessment meeting. After surgery, it's important that you eat and drink normally as soon as possible. So, on to your arrival at the hospital. This is usually the same day as your surgery. You'll be told what time to arrive. You'll be greeted by a nurse and taken to your chair space. If you haven't already been assessed, an advanced nurse practitioner or doctor will then assess your fitness for surgery, examine your heart and breathing, and prescribe any regular medications required. The nursing staff on the admissions ward will advise you when to change into a theatre gown. You'll also be measured for some anti-embolic stockings, which help minimise the risk of blood clots after surgery. These are generally worn for 6 weeks after your operation, and you'll be given advice on how to manage these when you return home. Next, your anaesthetist will come and see you. He or she will ask you about your health and discuss which kinds of anaesthetic are suitable for you. There are several methods that can be used.
Normally I will offer you a general anaesthetic where you're asleep. I do this by giving you medicines through a drip in your hand. This will then be combined with a spinal injection in the lower part of your back or with nerve blocks around the nerves in the leg which is being operated on. When you have had the spinal injection or the nerve blocks, you will not be able to lift your legs. The medicines will wear off and you will be able to move them again. At this time, you will require some painkillers. Please ask for them if you need them and don't refuse any that you are offered. Occasionally, it is more appropriate for you to be awake on the day of surgery. You can discuss this with your anaesthetist when you come for your operation.
Next, your consultant or a member of the medical team will see you to ensure that you've given consent for the surgery and draw an arrow on the limb you're being operated on. You will then be escorted to theatre by theatre staff. If you are able, we may walk you to the theatre, so please wear sensible footwear and bring a suitable dressing gown. When the surgery is complete, you'll be transferred from the operating theatre to the recovery area, which is like a small ward. A nurse will monitor your heart rate, breathing and blood pressure. You will probably have an oxygen mask over your mouth and nose and a drip inserted into your hand. Your surgeon or a member of the surgeon's team may visit you in this area and check your leg movements. If you've had a knee replacement, you may be asked to try and bend the knee. If you've had a hip replacement, you may be asked to move your ankles and feet. When the time is right, you'll be transferred to a ward. This is different to the admissions ward where you checked in on arrival. You'll find your belongings by your new bed.
Hello Mark, nice to meet you.
You will be closely monitored by nursing staff who will check your blood pressure, heart rate, breathing and temperature. This is all routine and forms part of the recovery process. It's normal to have some discomfort after a joint operation, but the painkillers we'll give you should keep this at an acceptable level. Everyone has different pain levels, so some people require more pain relief than others. You'll be given pain-killing tablets regularly whilst in the hospital. It's important to take your painkillers regularly for the first couple of days. If this does not control your pain or you have any side effects, then please let the nurses know so that we can prescribe something that suits you. It's common to suffer from constipation whilst you're in hospital, and the nurses will give you a mild laxative starting on the day after your operation. Make sure you eat plenty of fruit and vegetables and drink lots of fluid. You can eat and drink as and when you feel able to. In fact, the sooner the better. It's very important after your operation to make sure you can move properly and do your exercises. This includes moving in your bed, getting up and walking. Mobilising will speed up your recovery and reduce the risk of complications such as deep vein thrombosis. Your recovery time will be faster and you may be able to go home sooner.
Have a go at just pushing your knee flat onto my hand, that's it, so you're really squeezing the muscles here.
Blood clots are a rare complication and we try to reduce the risk by early mobilisation, calf or foot pumps, surgical stockings and blood thinning medication. You can help by moving your legs, deep breathing and drinking plenty of water.
See if you can hold it there and down. Brilliant.
If you're feeling well, the physios will get you out of bed as early as possible. This could be 4 hours after your surgery.
Brilliant.
They will move you from your bed to a chair with the walking frame and teach you some gentle exercises.
Operated leg and your good leg.
On your first day after surgery, nursing staff will continue to monitor you and plans for your return home will be confirmed. Staff will continue to help you with washing and getting dressed in your own clothes, and you should aim for independence as quickly as possible. You'll have a routine blood test and X-ray, which will be reviewed by a member of the team. Your physio will advise you on walking with the most appropriate aid. It may be a walking frame, elbow crutches or sticks, depending on your progress and confidence. For those having a hip replacement, any equipment you might require to assist in your recovery at home will be finalised today. You'll also be given exercises to help strengthen the muscles around the hip joint. For a knee replacement, the exercise will concentrate on bending and straightening the new knee joint. Please carry out these exercises as instructed by the physiotherapist on the ward. On your second day after surgery, you'll continue your walking and exercise programme. If you're still on a walking frame, the aim will be to move onto elbow crutches or sticks.
Okay, so coming down, take your stick down first of all.
You may be shown how to climb up and down stairs to ensure you're safe at home. For those who've had a hip replacement, the occupational therapist will show you how to get in and out of bed safely, on and off the toilet, and demonstrate any dressing aids you may need in readiness for your discharge home. Whether knee or hip, carry on with your exercises for the next 3 to 6 months after your operation, and you'll continue to improve. Any physiotherapy arrangements will be made and discussed with you. You're ready to go home when you've completed all assessments safely and you're medically fit. The team will prepare the necessary documents for your discharge. These may include a letter to your GP and any post-operative advice or contact details you may need. So it's almost time to go home, but first you might be transferred to the discharge lounge. You'll be given advice on how to continue your recovery and return to normal. The ward contact numbers will be given to you should you have any concerns once home. The nursing and medical staff will ensure you have the tablets required for you to take home. And finally, you will need to make an appointment with your practice nurse or GP 10 to 14 days after your operation to remove the skin staples and check the wound. Please keep the dressing clean and dry until then, and contact the hospital if you have any concerns regarding your wound. A routine follow-up appointment will be made for you to see your team 6 weeks after surgery. And that is your visit to the Royal Orthopaedic Hospital completed. Inevitably, you might have questions, so please remember we are here for you to provide advice and support even after you're back at home. It's important for you to contact us if you have any concerns. May we wish you a comfortable stay at the hospital and a fast and safe recovery after your joint operation. Goodbye.